Dr. Ken Landa. Thanks for watching. Let's talk about norovirus. Norovirus is extraordinarily contagious. It's a leading cause of vomiting and diarrhea from acute gastroenteritis in people of all ages. It's estimated that as many as 1 in 5 cases of acute gastroenteritis are due to norovirus. That means that at least 1 million pediatric outpatient visits are going to be made each year because of the norovirus, and somewhere up to 50% of all acute gastroenteritis in those over age 65 is due to the norovirus. It's a leading cause of foodborne illness and causes probably about 50% of foodborne outbreaks. It's also known as food poisoning or stomach flu or the stomach bug or winter vomiting bug or acute non-bacterial gastroenteritis. In the United States, we estimate there are going to be about 20 million cases this year. That means that almost 2 million people are going to go see their doctors because of the problem, 400,000 emergency visits because of norovirus infection, especially among young children. By age 5, it's estimated that 1 in 4 children will have seen a doctor in the emergency room because of this, 1 in 6 in outpatient care, and 1 in 300 are going to be hospitalized because of this virus. It's estimated that if we look at people who are less than age 18, there are going to be 4 million attacks, 4 million individuals affected just this year. If we look at people over age 65, it's another 4 million. Probably about 800 people are going to die, mostly in elderly individuals. There's an upward trend in this virus, in the frequency, because of globalization of the food industry, and because of more people who are taking drugs that reduce their immunity, drugs for arthritis that you hear advertised on the television all the time, or for psoriasis, or the cancer-treating drugs. On a worldwide basis, there are hundreds and hundreds of million, estimated maybe as many as 200,000 deaths from acute gastroenteritis. Now, this virus was previously referred to as the Norwalk virus or Norwalk-like virus because the first recognized acute attack, at least in the United States, occurred in Norwalk, Ohio in 1968. It was centered at the Bronson Elementary School, and this was a very important finding in medicine because before that time it was thought that acute gastroenteritis was due to either a bacterial infection or parasite. Nobody thought that viruses could cause the condition. Actually, there was a situation in Denmark in 1936, the rosekill illness, that actually was due to the same kind of virus. Well, the transmission is direct contact from person to person, infected person to person, or through food, or through water, or through touching contaminated surfaces and then putting your unwashed fingers in your mouth. The condition can occur at any age. The greatest frequency is among individuals less than age 5, then between the ages of 46 to 65, then people over age 65. But among people over age 65, the death rate is about 21-fold greater than it is in people who are between the ages of 18 and 64. So the virus can occur year-round, but it peaks, at least in the United States and other countries above the equator, sometime between November and April, but half of the cases are going to occur in December, January, and February above the equator, and most of them are going to occur between June and August below the equator. And it seems that whenever there's a new strain that appears, there's about a 50% bump in the number of cases. Now, the seasonality is more pronounced in non-healthcare associated outbreaks. A lot of outbreaks occur in hospitals or long-term care facilities. But the seasonality is more in people who just get the virus just because. About 7% of outbreaks occur in the United States because of international events. Now, there are multiple strains of the virus. It's kind of like the flu. So the one circulating around the world right now is something known as the G2P16 G24 Sydney. The first part of the name refers to the polymerase region B, and the second part of the name refers to the sequence of the capsid region C. But there are a lot of different kind of viruses that are in this group. Most of them right now are in the G2.4 strain. That's the genogroup 2 and the genotype 4. In recent years, in several Asian countries, there are other kind of viruses that are circulating, and there seems to be a boost every 2 to 4 years when we get a new subtype of the virus. And unfortunately, now with the international globalization of the food chain, it seems that the viruses from one area of the world can combine with viruses from another area of the world, and that leads to new strains. And then, of course, there's also the natural selection. So the viruses can survive on surfaces and objects. They survive on countertops and doorknobs and telephones and furniture and light switches and on handrails and faucets. They survive temperatures up to 140 or more. They survive freezing. And when a person vomits or flushes the toilet, there's aerosolization of the virus, and it can spread from anywhere between 10 and 25 feet. And then it's on the surface of a desk or a counter, and then you touch it, and then you can become infected. Well, the clinical illness appears somewhere between 12 and 48 hours after exposure. Now, if you're exposed to a relatively small inoculum, it could take a little bit longer, but you tend to have symptoms for somewhere between 1 to 3 days. Some people who have mild symptoms, they can have them for more than a week. Older individuals have symptoms that last usually between 3 and 9 days, but they could have a headache and other symptoms that can linger for up to several months. Now, 90% of the deaths that occur from this virus are going to occur in people who are over age 65. Most of them are going to acquire the infection in long-term care facilities, long-term facilities and hospitals. And they're going to die not from the virus itself, but from complications such as bacterial sepsis or aspiration pneumonia or some cardiac complications that can come on from dehydration and problems with the electrolytes. And people who are immune compromised, cancer patients and transplant patients receiving the transplant anti-rejection drugs, well, those people can shed the virus for months up to years. It's not uncommon for kidney transplant patients to shed the virus for up to year, 2, even 900 days have been reported. Sometimes you have to take people off the anti-rejection medicines so that the body can go and fight the virus. And it's not just shedding the virus. These people can actually have infection. And it can have a persistent infection that we call a norovirus-associated enteropathy, where they have malabsorption in the intestine, so you can't absorb the food that you eat. And if we were to look under the microscope at a biopsy, it would look kind of like celiac disease. Well, the infectivity, there are more particles in the stool than there are in the vomit. The peak shedding occurs somewhere between about 2 to 5 days after infection. Normal person sheds the virus for a relatively short period of time, but in some it could be up to 4 to 8 weeks, even in healthy individuals. If we look at the highest infectivity, it's going to coincide with the time when the person has the clinical symptoms and shortly after. So that means that you should stay away from work and stay away from school, not only for the time when you have the acute symptoms, but probably for 48 to 72 hours after the symptoms go away. What are the symptoms? You'll know if you've been infected for the most part. You have some nausea, but the major part is vomiting and or diarrhea many times a day. Children tend to vomit more, adults tend to have more diarrhea, but most people have a combination of both, but either can occur in isolation. You get abdominal cramps, and then some people can have other kind of symptoms. And some of the symptoms that you could have would be loss of taste and low-grade fever and a headache and body ache and general feel terrible and weakness and muscle aches. But somewhere between maybe about 3 and 10% of people who are infected don't manifest any symptoms. Now, because of all the vomiting and the diarrhea, you could have an imbalance of your electrolytes and some dehydration, and that can lead to decreased urination and problems with the kidney and a dry throat and dizziness on arising because you don't have enough blood volume, and children can cry but not produce tears because they're so dehydrated. And children can be unusually sleepy or fussy. And depending on the severity, because of the loss of volume, we can have dehydration and problems with the electrolytes, the sodium and the potassium. People can become malnourished, and they can, after they heal, for a period of up to 3 months, some people develop the irritable bowel syndrome with constipation and gastroesophageal reflux disease or heartburn. And some people have dyspepsia. It can cause some transient liver function abnormality because of dehydration, and there are occasionally seizures or gastrointestinal bleeding. And interestingly, a specific genetic variant of the norovirus seems to be able, at least in mice, to cause a type of Crohn's disease, inflammatory bowel disease. Now, compared to another common virus in children, the rotavirus, norovirus, tends to cause less fever, fewer episodes of diarrhea, fewer days of diarrhea, and less hospitalization, but you shed billions of particles. It's estimated that you only need about 20 particles to become infected, and some reports now suggest that you might become infected with as few as 5 particles. So how do you become infected? Well, you touch food with your bare hands, and there are particles on the from the feces or the vomit that are on your fingers, and now you contaminated the food. Or you touch a counter or a surface with fecal material or vomit material on it that you don't know and you can't see, and there are tiny drops of the vomit from an infected person that's sprayed throughout the air, lands on the food. Or you can breathe in some of the particles while you're cleaning up some of the vomit. Or traces remain on the floor because it hasn't really been decontaminated. It's just been cleaned. And then remember the aerosolization from flushing a toilet. Well, if you happen to have a bathroom and you have your toothbrush or your spouse's toothbrush or the kid's toothbrush out there, well, 25 feet of the toilet, the toothbrushes are going to be contaminated. The countertop's going to be contaminated. You touch the countertop, and then you put your finger in your mouth. You're infected. Transmission from food grown or harvested with contaminated water, oysters harvested in contaminated water, fruit and vegetables irrigated with contaminated water. You have septic tanks that can leak into wells and water perhaps not treated with sufficient chlorine, including swimming pool water. So if you do have an infection, certainly stay out of the swimming pool. People share food or share utensils, or you care for an infected individual. You have about a 60 to 80% chance of becoming infected. And remember, they potentially shed the virus for at least 2 weeks after, and oftentimes even longer. Well, the shedding causes a lot of infection in healthcare facilities, including the long-term care facilities. Outbreaks are commonly reported because the virus is introduced into the facility where it has a captive audience. And this virus introduced by infected patients or maybe the staff or visitors or contaminated foods worsen because people share rooms and the staff goes from patient to patient or individual to individual and have shared dining facilities. Attack rate in long-term care facilities is up to 60%. And the virus infection can last for several months. Seems to be more severe and more deadly in these patients. So long-term care facilities, well, for every 100 long-term care facilities, they're going to be somewhere up to about 17 of those facilities per 100 going to be attacked in any given year. Transmission is very common through restaurants and catered events. Actually, probably about 50% of all outbreaks of the food-related illness due to the norovirus going to come from either restaurants or catered affairs. Food can be contaminated at the source, maybe at the farm, or because of the fruit and vegetables that were sprayed with contaminated water. Any item could be touched with the hands after it was cooked. Then it's potentially transmitted or transmissible, the virus. frequently found in colleges and daycare centers, close quarters, the military, shared spaces. You hear a lot about it on ships, but actually ships account for fewer than 1% of the reported outbreaks, but 90% of the outbreaks on cruise ships are due to norovirus, again, because of the closed living quarters and shared dining areas and the rapid turnover of the passengers and the infected crew or the infected environment. And the virus often is resistant to the standard disinfectants. Actually, just recently, from November 21 to December 2nd, 2019, the entire school system in Grand Junction, Colorado, was closed because of norovirus. 46 schools, 22,000 students sent home. Some unfortunate individuals were previously infected, and then they seemed to get a new strain of the virus. So up to 5,000 individuals in the 22,000 school system, 22,000 individual school system, were infected or stayed home. Even the custodians were ill. They couldn't clean up the facilities, decontaminate the facilities, and many students couldn't get to the restroom or even the garbage container before they had to vomit. And they vomited on the floor. And remember, 25 feet, the virus can spread, contaminates the desktops, contaminates other surfaces. And nearby, and the United States Air Force Academy, through October and November of 2019, about 400 cadets were infected with the norovirus and were kept from class. Common food items that are implicated in transmission, and almost any. Could be the salads or the fresh fruit, could be ice or any uncooked food or cooked food that's been touched after the preparation. Could be a sandwich, a cookie. Could be through infected equipment in a healthcare setting. Fecal-oral route, remember, contact with inanimate objects, waterborne, possibly. You have to be constantly on guard. If you have shellfish, have to make sure it's been heated appropriately. If you have some berries, well, you better wash them because they might have been irrigated with contaminated water. And confirming the presence of outbreaks is extremely difficult because remember, the incubation period is between 12 hours and several days. And a person can have asymptomatic shedding and a small infectious dose, 5 to 20 particles, and a virus that can survive for months on different kinds of surfaces. So how are you going to determine where it was? Where did you get infected? Very difficult oftentimes. Well, it seems that individuals who happen to be either blood group B or AB may be less susceptible than people with type A or type O. But unfortunately, type A and type O are the major types. The susceptibility varies with the histo blood group antigens. And it seems that there was a mutation millions of years ago. And it seems that that mutation seemed to grant people certain kind of immunity. And then we have another kind of a protein, and it's called the melanoma differentiated associated protein. It's a sensor for viruses. It really has little to do with melanoma, but it has a lot to do with the body's capability of being infected. And some people have a variation of this MDA5, and that causes an increased susceptibility because the protein, the MDA5, isn't actually surveilling the body like it's supposed to. Now, there are certain criteria that we use to decide whether it's an infection from a virus or infection from a bacteria. But routine laboratory is pretty unhelpful. Maybe there's a slight increase in the white blood cells, slight increase in the neutrophils, maybe a slight decrease in the lymphocytes. And as long as the person isn't dehydrated, then there's no problem with the liver, the kidneys. We can test, mostly in large groups of people, with reverse transcriptase PCR, the polymerase chain reaction test. But this mostly in the public health laboratories, although a lot of clinical laboratories have the availability and they can detect as few as 100 maybe even as few as 10 viruses in the stool or the vomit or the food or the water or the environment, for the overwhelming majority of cases, these tests aren't done. And the reason they're not done is that you can have some of the virus and not be infected. The virus can just be carried along, so you don't know exactly what to make of a positive test. Well, there's an EIA test, an enzyme immunoassay, and we can do that on the stool. In epidemics where there are lots of people who are infected, we can sort of rule in or rule out whether the norovirus is really the cause. But even if it's negative, even if the test is negative, then to be really accurate, you need the reverse transcriptase quantitative PCR test again. And if there's really a reason to know, we can actually basically genotype or fingerprint the virus and see if the virus that you have is the same as your neighbor has. Now, the virus was first identified in stool on electron microscopy in 1972. It's an RNA virus. We know that there are at least 33 different neurogenotypes, the common genotypes in humans, G1, G2, and G4. We have lots of variants going around. The immunity that you develop after infection lasts only a couple months, maybe to 2 years, and extremely rarely up to 5 or 6 or 7 or 8 years. But unfortunately, it's only to that particular type. It's kind of like the flu. And there's so many different kinds of norovirus floating around, different strains of norovirus or subtypes of norovirus floating around, that the average person can be infected multiple times. The average lifetime infection rate is at least 5. And we know that, at least in the case that I mentioned in Grand Junction, Colorado, some of the students were infected probably twice. Now, the names of the virus, they have different kind of names. So sometimes we call it norovirus, depending on where it is, or Desert Shield virus, Southampton virus, Bristol virus, Lordsdale virus, Toronto virus, Mexico virus, or even the Snow Mountain virus. Now, there's a little story that it was officially named norovirus in 2002. But in 2011, the International Committee on the Taxonomy of Viruses, they're the group that gives the viruses the name, actually they requested that the name should be returned to Norwalk virus because of complaints from Japan. It's a family name. Noro is a family name. And people didn't want to be associated with vomiting and diarrhea. Well, there are a lot of variants of the virus, and the variants come from recombination and point mutation and a variety of other genetic and antigenic evolutions that occur. And as a result, since 1995, we've had 6 major antigenic variants of the G2-4 that have resulted in pandemics of the virus. Now, some of the noroviruses just infect animals, pigs and cattle and dogs, and so far we don't have any evidence that people have been infected with those particular types, although veterinarians do have antibodies to the animal types of norovirus, and animals can have antibodies to the human types of norovirus. And we think there's a reservoir out there somewhere. We don't know where it is, but people can be reinfected with the same type of virus that was circulating in the population 10 or 15 years ago. Where is it that the virus infection occurs? It occurs in the small intestine, in the cells that line the small intestine, not in the stomach and not in the colon. It actually is in the goblet cells, or the Brunner's glands, of the small intestine, and then it gets underneath the surface in the lamina propria, and then it gets into the macrophages and the dendrocytes and the T cells, the immune cells, can even get into the enteric nervous system. There's a question about what the role of the microbiome is. If we were to biopsy the small intestine, we'd find some villus blunting, just like we do in a variety of diseases, including celiac disease. We'd find crypt cell hyperplasia, and we'd find some vacuolization of the cells. We find an infiltration of the lamina propria with all of the inflammatory cells, and a decrease in the brush border enzymes, and that means that people get malabsorption causes a problem with barrier dysfunction, so we get diffusion of things into the body and out of the body that aren't supposed to go that particular way. How do we treat the condition? It's supportive. Antibiotics are of no value. Actually, antibiotics can make the whole situation worse. We use rehydration. They have rehydration solutions, but a lot of other kind of drinks are acceptable. Probably shouldn't have caffeine or alcohol. There's unrestricted nutrition. Eat whatever you can tolerate. There's Imodium that you can buy over the counter. It can decrease not only the number of bowel movements you have in any given day, but also decrease the duration of the illness. Lamodal just decreases the number of bowel movements. It will not decrease the duration of the illness. Prevention obviously includes washing your hands often. You wash them after you go to the bathroom. You wash them before you handle food, after you handle food, before you eat, before you take a pill, before you give a pill to someone else. You stay home when you're sick, and you wait for 2 days after the symptoms resolve before you go out, especially if you work in the healthcare industry or school or restaurant industry or daycare. You wash with soap and water for at least 20 seconds. The alcohol-based sanitizers don't seem to work very well. If you vomit if you can in a plastic bag, or if you vomit somewhere else, put it in a plastic bag. If you're making food, you heat the food properly, because remember, norovirus can survive temperatures up to 145 degrees or even more. The quick steaming process, well, that just doesn't seem to work very well. If you have a contaminated area at home, use a bleach-based household cleaner. Leave it on for about 5 minutes, then clean the area with soap and water. Take out the trash, wash your hands afterward. Before you prepare food, make sure you've properly sanitized the utensils and the counters and the surfaces. You wear gloves while you're dealing with soiled items. You wash the clothes with detergent and hot water, maximum available cycle length, and you machine dry them at high temperature. And make sure the water source that you're using to drink is clean, because unfortunately the virus, the norovirus, can survive up to 10 parts per million of chlorine. That's well in excess of the amount of chlorine that's used in public drinking water, which is less than 2 parts per million. And remember, norovirus can survive on the surfaces that are used for food preparation for at least 7 days. They can remain on hard and soft surfaces for weeks. And actually, they can survive for months and maybe even years in contaminated still water. Now, there's some antivirals that are being developed, but at least so far, they haven't worked very well. And more interestingly, there's a vaccine under development, but so far the vaccine type hasn't worked very well. So that's the story of norovirus, also known as the Norwalk virus. Common cause of food poisoning, regularly leads to both vomiting and diarrhea multiple times a day. And basically it's all because of lapses in hygiene. Remember, the virus typically travels from contaminated foods and surfaces, contaminated surfaces with either particles of vomit or particles of bowel movement. So wash your hands frequently, wash them with soap, and remember, 20 seconds takes a long time to get all the viruses out. Clean underneath your nails. And remember, all age groups are susceptible, and just because you've been infected once, that doesn't give you any benefit against being reinfected the next time. Anyway, thanks for watching. If you enjoyed the show, please tell a friend and consider subscribing so you'll be notified as we post new shows. I appreciate your interest. I'm Dr. Ken Landau.